I think in building the new system it will need the new optimism, it will need the new version of models of care, building recovery in communities, it will need the new clinical guidelines. Most critically, it will need new ways of measuring the positive outcomes we're seeking to achieve. And so when you look at the recovery outcomes and the range of potentially what these might be, that's one of the most fascinating and challenging elements of our new recovery orientation. On the one hand, there is a payments by results model which will pay providers for delivering recovery in effect, not just successful treatment completions. And this view of what a recovery outcome could be is driven very much by the marketplace. Slightly more incrementally, in terms of building on what was in place during the course of the last drug strategy, we have the treatment outcome profile. This is being critiqued quite extensively in terms of its suitability as a tool to measure recovery and progress through treatment. In particular, we need to look at TOP, as it's called, as a tool which enables clinicians to improve, and also as a tool and planning instrument which enables us to feedback very much more fully to people passing through treatment. So, you know, when you look at building the system, there's the foundation stone in terms of a more optimistic outlook. There's a commissioning framework, a service framework, if you like, the new models of care. There are the new clinical guidelines. There are new recovery measures, which we're seeking to develop, the new recovery outcomes, if you like. So that all those elements, when they fit together, they need to fit together with a workforce that understands them and is able to bring the appropriate skill set to bear on the recovery orientation. And the new National Skills Consortium has spent over a year designing the new recovery-based skills. So then you have those elements, all of them as I've described, the approach, the commissioning framework, the standards which are arrived at by Professor Strang's group, the clinical practice guidelines, the new forms of measurement, and the workforce skills. They are what I mean by building a new recovery-oriented system. And that much, I think, is clear. It's taking place. It's taking place unevenly, as you might expect, but it is being done very, very promptly indeed. And it's following on from the publication of the national strategy. So we're in a very exciting building phase. And that much, I think, goes without saying. There are certain other elements of the recovery orientation which are perhaps not quite so clear, but are equally important in terms of enabling the workforce and enabling all those who have a vested interest in recovery being able to position themselves in terms of where we're at the moment.